Assalamu alaikum. This is my presentation in 1013 Children with Special Needs, and I take the topic Characteristics of Visually Impaired Children. Visually impaired children means they have some problem with their eyes. They can't see as the normal children. The first characteristics of visually impaired children is their intellectual abilities are similar to those of sighted peers. They have the same intellectual abilities as their peers. Only problem is with eye vision. The second characteristic is they are unable to use sight to assist them in the development of concept. They can't use the vision to develop any concept. Then the third characteristic is their concept development depends on their tactile experience. Because they can't see anything, then they will develop their concept according to their experiences. Then the fourth characteristic is they are unable to use visual imagery. As we know, they can't see anything or their vision is low, so they are unable to use visual imagery. Then the fifth characteristic is they may display repetitive stereotyped movements. Then moving to the next characteristic, they are withdrawn, dependent, and are able to use non-verbal cues. They are unable to identify the non-verbal cues, and also they can't use the non-verbal cues to communicate. Then the next characteristic is they have difficulty using spatial information and visual imagery, and imagery problems with functional implication. They may have some difficulty to find the directions and all. Then moving to the next characteristic, they have unusual facial behaviors such as squinting, blinking or frowning while reading or doing close work. It is not in the case of completely blind one. If he is partially blind, then when he or she looking or doing any close work, they have these characteristics like squinting, blinking or frowning. Then the next characteristic is they are unable to locate or pick up small objects. This is also in case of not completely blind children. It is the case of partially blind children. They can see the large objects, but they may face difficulty to locate or pick up small objects. Then the next characteristic is physical indicators may include red eyes, swollen